Hello, I'm Dr Wong Mei Wan, a breast and endocrine surgeon at Sunway Medical Center, Sunway City.
Mari kita kenali bersama, apakah informasi ini mitos atau fakta tentang kanker payudara?
That is a myth. Actually, taking it in moderation that should not cause breast cancer. That is also a myth. Actually, a majority of our patients with breast cancer, up to 70%, does not have family history of breast cancer. It means that even if you don't have family history of breast cancer, you may still be at risk of getting breast cancer. That is also a myth. Actually, any woman can get breast cancer, regardless whether you are married or not, whether you have children or not, whether you have breastfed your children or not. So actually, any female is at risk of getting breast cancer. That is a myth. If you have breast, regardless of any size, you can still get breast cancer. That is also a myth. Majority of our patients with breast cancer do not present with pain. Most of the patients who came in with breast pain, confirmed with breast cancer, usually already at a later stage. So which is why we actually advise screening mammogram for every woman without any symptom or any pain to detect breast cancer. That is also a myth. Because the radiation dose for mammogram is very low, you have to consider risk of detecting breast cancer late as opposed to getting too much radiation from yearly or 2 yearly screening mammograms. That is also a myth. I do get patients with breast cancer who have history of breastfeeding their children. Breastfeeding is actually been proven to be protective risk for breast cancer, but it's not absolute. Even though you breastfeed your children, you may still get breast cancer. That is also a myth. If you are female, regardless where you are, in the city or kampung, you can still get breast cancer. That is a myth. Actually, a breast lump can still be benign. It may not be cancer. But I would advise, if you have a breast lump, please get it checked immediately by a doctor. That is also a myth. So far, we do not have any evidence-based research to say that any herbs or traditional medication can cure breast cancer. I highly recommend screening mammogram for every woman starting at age 40 and above. You can do the mammogram either every year or 2 yearly. However, if you have any symptoms or any issues pertaining to breast, you can come and look for me or any of my colleagues at Sunway Medical Center, Sunway City.